I'm Gilda Evans. This is Chris Cope. We're really happy to be here today. We represent the Autism Resource Project, but I'm going to start with a little quiz because I don't want to be the only one working up here, right? You all are going to work. And I'm going to go through a list of names, 3 at a time. And I want you, by a show of hands, to tell me which person in each group you think is neurodivergent. All right? We're going to start here with Elon Musk, Walt Disney, and Albert Einstein. How many think Musk? Okay, Jerry Seinfeld, Emily Dickinson, Dan Aykroyd. Seinfeld? Dickinson? Aykroyd? Okay. Last group, Nikola Tesla, Susan Boyle, Greta Thunberg. One of them, neurodivergent in some way. And I think we can all agree that they all did amazing things, right? So why do you think that these people were capable of rising to the heights that they did? Any thoughts? Why? All right, I'll tell you. Because they were resourced and given the supports that they needed to thrive and to rise to the people that they were capable of being, right? Research has shown that early intervention is very important, right? But also discovering the proper resources, tools, information that children need to thrive, to grow, and the supports that they need to become the best people that they can be, right? So that's where ARP comes in, Autism Resource Project. We are parents, allies, professionals, neurodivergent individuals themselves that have come together to do something about the marginalization and underserving of the neurodivergent and disabled populations. I have a question, last question, I promise. Who among you either knows or is related to someone who's neurodivergent? I'm surprised not every one of you is raising your hand. It's kind of like a realtor. Everybody either knows one or is related to one. All right. Truly, I'm gonna share some stats with you, and then I'm gonna get personal. Here, according to the CDC last year, and when these stats come out, they're already old. Last year, 1 in 30 gets newly diagnosed with autism here in the United States every single year. That's just autism. That doesn't count any of the other neurodivergent diagnoses. That doesn't count the physical disabilities. Throw those in, you're probably inching down more towards 1 in 20 in the US. Now let's extrapolate that to the global population. 75 to 80 million diagnosed with autism. Just autism. Just the ones who are diagnosed. Many go undiagnosed, right? Throw everything else in, you're talking about 1 billion people. That's 1 in 5 people on this planet. Their families, their caregivers, their spouses, their partners. We're talking about a huge population. So why then, for this huge population, is there no central knowledge and resource base that an individual, a caregiver, service provider, educator can go to with a question and find the beginning of the answer? I'm going to tell you that I have an autistic son. He was first diagnosed at 3. He's 26 now. He's doing great. All right. But when he was first diagnosed, I remember that feeling so vivid, like being out in the middle of the ocean, treading water with no land in sight and no idea what direction to swim in. And I had a question, and I would call half a dozen people with the same question, and I would get half a dozen completely different answers and have no idea which one was right, if any of them were right. And I ended up right back where I started. And who suffered the most? my son, because he wasn't getting the supports that he needed. And when I asked for something, the answer I usually got was either no, or we don't do it that way, or we've never done it that way before. Now, me being who I am, responded to that with, well, then this will be the first time. Work with me here. There's a first time for everything. Unfortunately, a lot of parents stop at the no, or if English isn't your first language, forget about it. So I spent the better part of, well, 2 decades plus battling with the schools, and here in California, the regional centers, the government offices, whoever else I had to do battle with to get my son what he needed in order to thrive. And so fast forward, he's doing great now. The system pushed him into a school at one point where this incredibly intelligent, affable, wonderful young man refused to do the work and absolutely froze until I went to fair hearing and got him into a school where, where he was able to thrive and graduated valedictorian of his class and gave an amazing speech that brought everyone to tears. But the point being, why did I have to go through that? Why did I have to go through all of the hours and hours and days and weeks and months and years of battling to get my son what he needed? I know, and these stories are absolutely true. Another member of our board of directors, when her daughter was diagnosed, spent hours on her closet floor crying because the doctor said, I don't know what to tell you. There's nothing I can do for you. Bring her back, in 10 years and I'll, maybe we'll have an answer then. And you know what? She's not the first mother I heard from that ended up on the closet floor in tears. Another woman I know who's an educator. And there was a little boy in her class that would never look at her when she was trying to teach him something. And she kept on him, Johnny, look at me, I'm talking to you. And what she didn't realize was when Johnny wasn't looking at her, he was paying attention. He was hearing every single word that she said. But she didn't know that because nobody ever trained her. Nobody ever taught her. There was no place she could go to get the information that she needed to be a better teacher and give Johnny what he needed to learn and to grow. So Autism Resource Project, together with our amazing board of directors, who Chris will share with you momentarily, we are creating a first of its kind online 24/7 global platform for neurodivergent individuals, parents, caregivers, educators, whoever, when they have a question, an issue, a concern, a problem, to go to and at least find the beginnings of what direction to start swimming. It is going to be a resource hub, a network, if you will, a place where right now, if you need a thingamajiggy, where's the first place you go? You go to Amazon, right? Well, if someone in the neurodivergent or disabled community is looking for XYZ product, XYZ service, information, whatever, they're going to go to ARP because that's who we are and that's who we are becoming. So anyway.
We're actually thinking about changing our name to the Amazon Resource Hub. No.
So we are with the Autism Resource Podcast as a hub. The podcast I started about 5 years ago. We're 150 episodes plus strong. We've been listened to in 13 countries. We've had tens of thousands of downloads. And what that says to me is that the world, not only the United States, but the world is hungry for a place to go to find this information, to take all of the scattered myriad resources, information, everything that's available and bring them into one easily accessible resource hub and network. And that's what we are creating. It doesn't exist right now. I can't tell you how many people have come to me, and when I share with them what we're doing, people in the community, and said, oh my God, I've been looking for what you're doing for years and I've never been able to find it. Thank goodness, finally, somebody is doing it. So in addition to the podcast, we are going to be adding a library. We're going to be adding community network. We're going to be adding a marketplace. We're going to be adding a very robust cross-referencing search mechanism. We're going to be adding a vetting feature so that people in this community can come to a place where they feel safe, where they feel resourced, where they feel understood, and where they can find the information, the answers, the resources that they're looking for. To date, it does not exist, and we're going to change that. And Chris is going to share with you a little more in detail of how we're going to do that.
Thank you. Although you covered most of my point. No, but in all seriousness, I want to take a moment to introduce you to her. Her name is Gilda Evans. She plays down her role and everything that she's gone through in her life and dealing with her son. And, you know, you have a lot of other baggage too. So we won't share that right now, but she's an amazing human being is my point. And she started the Autism Resource podcast like 4.5, 5 years ago because she wanted to share the insight and the experiences that she's had. She actually knows how to navigate all of the bureaucracy and red tape that you have to go through to get anybody somebody you provide care for, or your loved ones, your children, to get them the resources they need through the regional centers in the state of California. And let me tell you something, it's not easy. And you have to go through a lot of different resources. You need one for conservatorship. You need different ones for, I don't know, psychology, psychiatrists. I mean, whatever the need is, you've got to go to different resources. And she knows how to navigate all of those things. And in fact, she's been doing that for the longest time for other families. And so that's kind of the impetus behind the Autism Resource Project is we have people all over the place that need these resources and they don't know where to go. And she mentioned this earlier in that somebody is, their child is recently diagnosed and they don't know where to turn. Their doctors don't have answers for them or anything like that. And so the Autism Resource Project is, founded on those 4 pillars, the podcast for communication, and up-to-date information from some of the brightest and best minds in the world that are addressing, these medical needs in our population. By the way, if anybody wants to be on her podcast, you can sign up. We would love to have you. No, but in all seriousness, you can't really get on because we're booked up until next year. No. But we want to really bring out all of this information from a library standpoint, from a communication and education standpoint to the world and let them know what people are doing. I mean, I was kind of fascinated with Robert's presentation just now in terms of how the different sequences and the different, I don't even have that many $25 words in my vocabulary, but it was really amazing. And I followed about 20% of what you said, but that 20% was amazing for me as a neurotypical person. Am I neurotypical? No. But to understand and just be knowledgeable about the information that, is out there and the work that, people are doing, because I have a story too. My son's 30 years old, just turned 30 on November 8th. He was diagnosed at 9 months old. And here is having this source of information, having a resource that you can turn to, like the Autism Resource Project will provide. It's really, really important for families, and it's really, really important for the people that have the need, so that we can find the resources. I mean, the idea that you're potentially on the cusp of not only identifying the problems that with Rett syndrome, but maybe reversing it. I think about autism, and I think about the issues and the environmental effects, whatever's going on in our world, why we have such a tremendous growth in the number of diagnoses every year. And I think, wow, are we that close that we could actually address this particular issue? And I hope we are. But in the meantime, we need people in the communities. That's the community component of the Autism Resource Project. And these people are going to be on a national level, a regional level, a local level, and a community level. And so if I have my son is diagnosed with autism tomorrow, I know where I can go and find somebody in my immediate community that, if nothing else, they can be a sounding board and be somebody that, can relate to what I'm going through. But more importantly, on a global level, is to provide them the information, the resources, the support, the products, and a knowledge base of other people that have gone through it, to enable their loved ones to thrive. And it's interesting. We like to avoid words like different or differently abled or whatever word we've used in the past. But the reality is, people aren't really neurodivergent as much as they are just neurodifferent. And just because somebody doesn't fit into a particular societal mode or community construct, doesn't mean that they don't have something more important to offer or something different to offer or a different perspective. And so, I think that her point with, the groups of 3 people, all of those people are neurodivergent, and all of them had opportunities to share their knowledge and their insight and their perspectives on the world, and it made the world potentially a better place. And so that's what we're trying to do with the Autism Resource Project.
The library, the network, and all that stuff. I just want to point something out. We're here to talk about mental health today, right? You saw Chris's reaction when he started to talk about his son. I just want to say that the prevalence of frustration, anxiety, depression, suicidal ideation is so prevalent among this community, not only among the neurodivergent individual themselves, their parents, their families. We're talking about virtually 100% of people in this community that experience those things to some degree. And what has been shown to mitigate that and lessen that, if not eliminate it completely, is access to the proper resources and information and services. And that's what we aim to provide.
Most of them don't even make it past the first 10 episodes. She's on 150 plus. She's been doing it for 4.5, almost 5 years now. We have so much demand for from people to learn more about what she knows and what speakers we bring to the podcast know about neurodivergent populations, emerging technologies, emerging learnings, all of those kinds of things. And some of these people are the most dynamic individuals you've ever listened to, and some of them put you to sleep, but they all have really, really great information to share. And I know this because I edit all of the podcasts. Please shoot me in the face. But it's really just amazing information, and we really are booked up through August of next year. But we have so much demand, we have so much information, we have so many really, really keen people, and I suspect I'm going to learn about more of them, over the rest of today here in this room. But we want to have you on our podcast. We want you to share what you know about, your different disciplines and how that affects the neurodivergent, populations. So that's going to accelerate to the point we're probably doing one a week. And then there's the marketplace. The marketplace has everything from adaptive clothing to weighted blankets, noise mitigation. I mean, there are a lot of different things you've probably heard of or even experienced yourself that really apply to the neurodivergent population, the autistic community. I was telling somebody last night about, I mentioned adaptive clothing. And he's like, what is adaptive clothing? And I said, do you remember when the NBA started coming out with their sweats and they ripped them off like that? And he's like, yeah. I'm like, that's adaptive clothing. He's like, what do you mean? I'm like, a lot of people are confined to wheelchairs, and so they can't fit into the normal clothes that we would fit into every day. And so adaptive clothes work around those situations. And he's like, was that really they got that? It was a adaptive clothing and they adapted it to the NBA. And I was like, no, but it sounds like a great story, doesn't it? So that's marketing, by the way. You're welcome. Marketplace, the library is a resource of white papers, of different resources, things that you write. That presentation that Robert did, I should put that up. Probably, I don't know how many people would actually digest that information, but in all seriousness, there is a lot of information out there. There's also a lot of bad information out there. There's a lot of misinformation out there. There are a lot of autistic organizations around the United States, a lot of them. And you're like, well, what are you doing that's different? Well, one of the things we want to do is curate the information so that we are providing them, the most up-to-date information, the most specific and verifiable knowledge base on autism and neurodivergence. And we want to make sure that when you access a resource that it's up to date and current, but it's also founded in common sense and logic and science, to a large degree. Not anything that's subjective, but very objective. And so we're going to curate that information from a library standpoint. The other thing is really exciting about the community aspect is anybody watched Love on the Spectrum at all? Thank you. One person. It's really interesting about that. People used to ask me, well, do you like that show? And I'm like, not really. And they said, why not? And I said, because it doesn't really actually show what it's like to be autistic and in an environment like that. And it doesn't really show what the crew, the directors, the producers, how they manage people that are on the spectrum so that you get to see that amazing product that, is ultimately displayed on television. And that's the magic of the industry of filmmaking. But it's actually not. I mean, it's unfortunate that we don't. Now, don't get me wrong. I like the show. I mean, it's entertaining. And I do believe that it has some value in terms of educating people about the communities. But there's so much more that we can do in that regard. And one of the things that we also want to do is create a job center or a job portal. Because there are a lot of jobs out there that neurodivergent or autistic people, or even people with physical disabilities and mental disabilities can do. And
85% unemployment rate among the neurodivergent population, by the way.
Yeah. And there are a lot of companies out there that are willing to make accommodations for people like that, but there's nowhere for them to really kind of post those things. And so now you're back to this community component where the parents have to work with a regional center and somebody who actually cares at the regional center to help you find jobs or anything constructive that gets them out of the house, that makes them feel more part of the community. So that's one of the aspects of the Autism Resource Project that we want to provide. I mentioned Love on the Spectrum because we've interviewed people through the podcast that actually provide dating services for people on the spectrum, and they talk about social skills and communication skills and what you really need to do as an autistic person if you want to engage, or what you can do, not necessarily what you have to do. And so that's the concept of the Autism Resource Project. And later today we'll be doing a more kind of condensed down version of that. But the idea behind that is, yes, we want to provide all of those services. We want to provide all of that information. We want to provide those kinds of resources for people, but we can't do it with just, blood, sweat, and tears. And so that's what we'll be talking about later this afternoon. And I guess that probably, oh, and by the way, I just want to, I want to show you, like, these are some of the people that are on our advisory board. And a lot of them have been interviewed by Gilda on the podcast. Just really, really amazing human beings. I don't want to go into their biographies because I want you to look at them and say, oh, that person looks interesting, and I want to find out more about them. So you're going to go to our website, and that's going to help with our analytics and so, thanks. But at any rate, that's my bit for Autism Resource Project. Appreciate your time, and I know it's not amazing medical research, but it's important, and we appreciate the opportunity to be.
Yeah. Questions?
All right, questions.
There's a question from online, if I can ask.
Yeah.
Thanks so much, Gilda and Chris, for that talk and for sharing. There's a question online here. So she's asking, what is lacking at Autism Speaks that is being done by the Autism Resource Project?
Well, Autism Speaks, they do a really good job of educating people about what autism is. And they do a really good job about raising money and about promoting Autism Speaks. This is my opinion. But they don't really provide the kind of comprehensive resource hub. When you're a parent, let alone the parent of a neurodivergent child, you don't have time to be a detective. You don't have time to go searching all over the etherverse for all of the different myriad resources and information and services. And if you do find something that you think maybe it's what you're looking for, is it really is it going to do what it says it's going to do? Is it any good? You don't know. We're not reinventing the wheel at Autism Resource Project. We are bringing the myriad resources and information and service providers and products together to make them easily accessible in one place. That Autism Speaks doesn't really do that. They aren't really a resource hub or a network in that sense.
There's a lot of information on Autism Speaks, but it's not relevant to, a parent, for example. It's not relevant to a caregiver. It's not relevant to an educator. That's one of the other things that we want to do is provide educators, teachers. And my wife is a teacher, and she teaches in a Title I school, and she deals with a lot of neurodivergent and autistic kids, and they all have IEPs. And the IEPs are managed by generally a vice principal who goes to multiple schools and oversees all of the IEPs, but has no training whatsoever in dealing with neurodivergent or autistic community. Then it's managed by somebody else who's also a regional care, no, not really care, somebody who is assigned by the school district to make sure that the IEP is followed. So then they go into the classroom and then they evaluate the teachers, my wife, who raised a neurodivergent and autistic son for the last 30 years and gets criticized by these people that come into the classroom and say, you're not following the IEP. Well, my wife aside, there are no training programs or modules that teachers can sign up for in the California school district or any school district really for that matter, where they can learn how to deal with these particular issues or how to follow an IEP properly. And so this is what Autism Resource Project is about, bringing it down to the individual human level and addressing the needs of the people that are providing the care and that need the care. Whereas Autism Speaks and a lot of different other organizations out there just have a lot of information out there. And I mentioned misinformation before about the autism community. My biggest issue is disinformation about the autism community. And let me just draw a line in the sand. There is not a cure for autism. And the MMR vaccines did not cause autism. So that's our foundation. And anybody who says differently, then you're in a different community than we are when it comes to autism. Oops. Yeah.
Any questions? Any other questions from online?
Sorry. Yeah.
The questions online.
Okay. Any other questions in here? Okay.
Thanks for
All
indulging.
right. Thank you very much.